Have you ever scrolled through social media content online and thought, I wonder if that's true? With the volume of information that is hitting us every day about our health, it's getting harder and harder to separate fact from fiction, and that is what we are here to do. My name is Stokes-Parish. I am a nurse, educator, and critical appraisal enthusiast. And in this series, we will break down a research paper systematically working through whether the information is as it seems. Whether you're a health professional, a student, or just somebody who loves researching health information, this is the place for you. Today's paper comes from a follower recommendation. Thank you to Emeritus Professor Burrows at Truman State University who sent this one through. And it's titled Exposure-Related Anxiety and Improving Patient Satisfaction with Medical Undergarments During Surgery. So by way of very brief overview, this study was looking at whether patients preferred wearing an open back gown during surgery or whether they preferred the open back gown and undergarments. They used randomized control trial methodology. Now, you know my thoughts on RCTs and patient preference. One of my very first videos looked at this, and I'm not convinced that their research methodology actually addressed the question of patient preference. Looked at this, and I guess I would have thought this was a no-brainer. If you've had the pleasure of surgery, think back to wearing an open back gown with your derriere exposed versus wearing undergarments. I would have thought the answer was obvious. However, I digress. So, patients who were receiving orthopedic surgery were randomized to one of two groups. They had the normal treatment versus the intervention, which was the normal gown with the undergarments as well. The findings were negative, actually. There was no statistically significant difference in self-reported ratings between the groups. So let's use the CRABS framework to systematically unpack the paper itself. We begin with conflict of interest as the first in the CRABS mnemonic. This study was actually funded by an undergarments manufacturer, and that same manufacturer provided the undergarments themselves for the study. Unfortunately, the detail provided in the paper doesn't give us enough information to work out how involved the funders were. Did they just give the money to the researchers, or were they involved in the design and the analysis? One author simply states payment made to institution in their conflict of interest declaration. Perhaps COVR Medical paid this hospital to do the study for market research or just to understand how it works, but we can't make that determination with the level of information that's provided. So a bit of a bummer there. Moving on to R for reference, I'm actually going to use the CASP appraisal checklist for randomized control trials. If you're not familiar with CASP, this is a critical appraisal research center that actually provides best practice standards for reporting and research. And this will serve as a really nice tool for us to be able to assess the quality of the paper itself. So first question on this CASP checklist is, did the study address a clearly formulated research question? So yeah, when you look at the paper, there is a research aim described. The authors state, the purpose of this study was to measure exposure-related stress and or anxiety in patients undergoing orthopedic surgery and to determine if hospital garment selection impacts patient perception and satisfaction. We hypothesized that some patients would express stress and or anxiety with exposing their private intimate parts in a medical setting, and that providing patients with surgical undergarments would improve their satisfaction and make them more likely to recommend the facility to friends and family. So I think there's two main objectives here. One is to measure stress and anxiety, and two, to determine if the garments impact that stress and anxiety associated with intimate part exposure. They also described two hypotheses, which were those last parts where they say we hypothesized that. Now, in my opinion, they were not explicit enough. The hypothesis should have been something more like patients in the control group would rate stress and anxiety higher than patients in the intervention group. And you would have also expected to see the opposite. patients in the intervention group would rate their stress and anxiety lower. Now, I did find it a little bit weird that some of the questions were about providing whether they would recommend the hospital to somebody else. But anyway, maybe this is just something that's unique to this particular research group. When we move through the CASP checklist, we look at randomization, and it tells us that the randomization occurred on a block basis. That is, a certain number per week were allocated, but there's very little detail on how they randomized that process itself. Patients couldn't be blinded to the intervention for obvious reasons. You know whether you've got the undergarments on or not, and there was no concealment for the same thing, so the researchers would know. This means that there is a risk of bias now introduced to the results, and it might influence how the results come up. In terms of the participants themselves, they were demographically quite similar, except that they excluded patients over a certain body size because the products didn't come big enough. So, weight, stigma, and bias in action. Not cool, COVR. From a study measures perspective, they did calculate power calculations and they described what their analysis would entail. But they didn't provide readers with a copy of the pre or post survey and instead gave really vague descriptions, which was a bit of a bummer. As for the results, well, the results are really poorly reported. They provide descriptive summaries, and when they report on p-values, they don't report on confidence intervals, which is what helps us determine the reliability of that p-result and the results more broadly. And as I highlighted in the introduction, this study actually had negative results. That is, the patients had similar scores between groups and there was no statistically significant difference. And yet, these authors use their results, discussion, and conclusion to assert that undergarments will reduce exposure stress. In the discussion itself, the authors fail to even revisit their hypothesis and they provide no recommendation to reject or accept the null hypothesis. In this case, their poorly described hypothesis is rejected. There was no link. There was no proof that wearing the undergarments resulted in a perceived better care or perceived satisfaction of care. And on top of this, there are plenty of validated stress and anxiety tools out there that probably could have been used in the study instead of making up their own perception survey. And the problem with a perception survey like this is it was basically just asking, how do you feel? And they haven't validated the results. And so there's no way to say whether this survey was a reliable way of measuring stress and anxiety. And when we talk about things like stress and anxiety, we have to be very specific about what we're talking about, which is why I would have thought that they would have selected a pre-designed and validated stress and anxiety tool. Or if they really were just looking at hospital satisfaction, then I would have thought that there was probably some sort of satisfaction survey out there that was already validated and could have been a much more reliable indicator. So when we move on to A for author, the authors are a mix of an orthopedic surgeon, a biomedical engineer, a nurse, a physician assistant, and a nurse PhD. A pretty multidisciplinary team, so that's a good thing. And their senior author is a prolific researcher and a director of the Research Institute. But I couldn't find links to this kind of research around patient experience or patient perception before. As for B and buzzwords, there's no buzzwords that I can see. And when we move into S for scope of practice, part of the challenge here is that maybe the objective of their study is not quite so aligned with their research expertise. And this might be why we've seen some of the questions not being quite right, or the lack of detail, or that they may not even be aware that there are measurable scales for anxiety and stress in the clinical context. So what's my verdict here? Well, I don't think that this study answers the question of whether patient satisfaction improves with modesty garments. Yes, sure, we have an outcome that says, no, it doesn't matter. But my issues with this study are threefold. One, The authors misrepresent their findings, misleading readers, and inaccurately encourage hospitals to provide medical undergarments for their patients. 2, there's a lack of clarity about their aims and objectives, and there's a lack of detail in the methods themselves. And 3, I just feel like this seems like a bit of waste of research resources. As scientists, health professionals, and researchers, we have an obligation to consider how we answer questions, whether we're qualified to answer those questions, and whether we're answering those questions in the right way. And I don't think that the question matched the methods, and therefore I don't think it adequately answered the question of whether patients are more satisfied with wearing modesty undergarments. Well, that's a wrap on today's deep dive into modesty garments and surgery. I hope that you learned something new and that you found some little tidbit that you can use when you're assessing the quality of information online or even reading a research paper yourself. If you have any ideas for future topics or you have a paper that you wish to share, feel free to drop it in the comments or to submit a query via my website. If you loved this, then I'd love a like and subscribe, and I hope to see you next time.